Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. And good day everyone. So I'm Muhammad Rashidi Muhammad Yazid. My metric number is D1800019. I am a vet student from University Malaysia Kelantan. So today I will be performing a physical examination for cat. So everyone, let me introduce. This is Parrot. She is about 6 months old. She is a tricolored cat, calico. She quite active. So without further ado, let's start.
So we start with fundamental system with her eyes, and as far as I concern, I don't see any abnormalities or redness, and her eyelids are good, no conjunctivitis or any other ophthalmic diseases. And I look the pupils respond to the light after the video, and her eye dilation and constriction is normal. And then I'm going to check the ears. When I check the ears, I'm checking for redness, any debris or external parasite, and her ears are a little bit dirty. We as an owner should keep our cat's ears clean to avoid any infections or other possible problems, and make sure to look inside their ears at least once a week. And then I cannot see deeper in the ears because of the lack of instrument. Now I'm gonna move on to the integumentary system and start to check the skin. I'm looking for any redness, scabs, flaky skin, hair loss, external parasites such as flea, ticks, and etc. And I don't see anything like that while I'm checking. I'm gonna check around her rectum area now. I'm just looking for the same things such as redness, swelling, irritation, discharge, hair loss, and anything like that. And I seems she's fine there, all good. I also check the urinary system, which I look right around her exit area or vulva, and I'm looking for a discharge or inflammation or swelling or maceration of the skin or pus. She seems to be having no problems at all, and everything looks normal there. Now moving on to the nervous system, there are several ways to check, and I just put their pulse, and usually they correct them right away, and that is the signs of a normal reflex. And I've seen her walk, so I know the gait is normal, the reflex is good, and she's not dragging or having a health tilt or etc. I also check the musculoskeletal system, how parrots walk, which I see her walk well previously, and I didn't observe any lameness or abnormal posture and movement or any deformities, and I'm pretty comfortable saying that everything is normal. And now I'm gonna go into the circulatory system. So I'm gonna auscultate her heart, and I'm gonna be listening for any arrhythmias, pulse deficit, abnormal sounds such as murmur, and like that. So from here, I didn't hear any abnormalities. The heart rates around 136 beats per minute, and the normal heart rate of the cat around 120 to 140 beats per minute, so it is normal. Now I'm gonna auscultate her lungs, the respiratory system. Okay, I was listening for any sound of cracking, wheezing, or any abnormal sounds, and I don't hear any sounds like that from my observation. And I also observe her nostril movements or any coughing or roaring sounds. I also check her nose, and the airways is clear. There's no discharge at all, but everything seems normal, and parrot seems pretty fine. So now we move on to the digestive tract. or digestive system, I'm going to do the direct physical palpation of her abdomen area. So I'm just feeling the palpation with gentle pressure, and I'm feeling for the abdominal structure through the abdominal wall to feel anything enlarged or any abnormal masses or distension, anything abnormal that I can feel. And I don't feel anything like that. Everything is just kind of rolling right where it should be, and everything feels normal. So overall of the body score, I would give parrots the ideal 5 score, and because of the ribs can be palpate with slight fat covering. So now I'm going to palpate the lymph node. So I'm checking for any enlarged lymph node or any abnormalities or pain reflex masses, and seems to be the lymph node in a normal size. So now I'm gonna check parrot's temperature with the digital thermometer at her rectal area. We have to make sure that the instrument in contact with the rectal mucosa, and left the instrument for 20 to 30 seconds. And her temperature reading is normal, 38.4 degrees Celsius, which normal temperature for cat is around 38.6 plus minus 0.5 degrees Celsius. So no hypothermia or no hypothermia at all. And now I'm gonna go ahead and check her mucous membrane, and I see bright salmon pink and moist mucous membrane, and no ulcer or any vesicle, and her teeth also clean, and in scissor bite pattern, and no obvious staining, and the tongue also in a good condition. And then I check the capillary refill times, the CRT, and it is less than 2 seconds, so that's good, that is normal. And then I'm just gonna go observe her skin tan, and it is falls really quickly, return to its places, and no any signs of hydration at all, and she seems bright, alert and responsive. Yeah.
Okay, so everyone, I think that's all from me. Overall, the cat is healthy, bird is healthy, and thank you, Bird, for giving me this opportunity to work with you. And yeah, that's all. If there are any mistakes during this physical examination, please do tell me, and I'm sorry for that. And yeah, have a good day. That's all. Thank you, and Happy New Year. Bye.